But another one that I want to talk to you about is the idea of personalization. Most of medicine is generalized protocols. It's blanket
Yeah.
protocols. What is your
Yeah.
diagnosis? Okay, here is your protocol for the whole
Hmm.
population of people like you. Not at
Yeah.
all giving into we're each unique, we're each different. Why we're here, even, and why we have these symptoms is completely different from the next person with the same exact symptom. So, we love to focus on personalization, individualization, tailoring each individual treatment to each patient. But I wanted to hear how you do that with your clients, because always that level of personalization is a little bit different from each clinician and each
Yeah.
professional. So how do you go into your levels of personalization with clients?
So my mission is to provide education, and I'm the type of leader and expert that wants you to be your own leader. Like,
Mm.
don't do it because I tell you to do it, because you want to do it, right? And that's why I am writing a book on how to become your own nutritionist. And I have a course where people, the group coaching course, and obviously one-on-one, where I provide all this knowledge to my clients of all the things that they can be and should be doing for them to feel empowered enough. It's like, actually, and then when they imply and they're trying to do it, right, and they're applying all this information in their life, they're actually feeling the difference. And with that, they're feeling empowerment to be able to make decisions for themselves. So it's no longer about, oh, just because Ella told me, that's why I'm doing it, or because like I read it on Instagram, like my doctor told me, I read this book, right? No, I'm doing it because I know what's good for me. Like, I know what's out there, like veganism is out there, keto is out there, right? And I know what's right for me. Right. And I don't do it because everyone else is doing it. I'm doing it because it's right for me and how it makes me feel. Right. That's what I call personal responsibility for your health. And that's why I'm just, like, just because I'm a nutritionist, it doesn't mean I know what's like right for you. I could like guide you towards the direction. Like, that's why I do the elimination diet as my number one tool. Right. There's people who are not allergic to lactose, and they don't have anything that's like shows that they can't digest lactose or casein, right? But like they do better with that. Same thing with gluten sensitivity, right? There's celiac and then there's gluten sensitivity, all right? And they tell me like, I just I keep feeling bloated, I keep feeling fatigue and lethargic, and then when I don't eat gluten, how do you feel then? And then you're like, oh, it's not because Ella told me never eat gluten, it's because I feel better without it. Right. And when I do eat it, I take responsibility for how I feel. Or when I overindulge, right, I know that my blood sugar is trending high and I know my insulin's trending high. Like, I know I can't expect weight loss. And that's just it. And that creates this like lifestyle around it. Like, you know what to do, right? You're educated and empowered enough, and life happens, right? No one's perfect. Even just because I know everything about diet doesn't mean like my diet is perfect. I travel, things happen. I try my best, right? But like having that compassion combined with intellect and knowledge is what I give my clients to be able to personalize their diet. But of course, I provide them all types of testing and the information that they need to consider before they give up meat, right, and never eat meat again. All right, I was like, this is my job to tell. Or same thing about fasting, and if they want to prevent inflammation, right, it's my job to tell them about the best approach to fasting, and it's their responsibility to tell me like, this doesn't work for me for my lifestyle right now. I was like, okay, but it, right? And if not today, then maybe next month or like next year, when you're like ready to take responsibility, you might want to tweak some things in your lifestyle to make it more, friendly to your healthy habits.
Yeah, I think this idea of intuitive nutrition, knowing your body knows what
Mm-hmm.
it wants. If it craves salt, there's usually deficiency of sodium,
Yeah.
of other things, and your body is
Yeah.
actually craving it for a reason. I think it becomes really difficult when you've eaten like crap for a long time and you've literally gotten addictive to some of the
Yeah.
bad things, right? Like kids
Yes.
love sugary things. That's not intuitive eating. That's literally their brain craving a drug that is sugar, that is refined sugar, right?
Mm-hmm.
So I think you need to separate the two. And I think what you're doing is empowering somebody to be able to do that and recognize what is good for them, and to understand not to listen to the influencer on Instagram that did it their way, because it's
Right.
not going to be your way. I hear too many
It's
people that
also,
just find someone big and latch on, and I got to do it this way. And then,
yeah.
oh no, I'm still bloated. Oh no, what happened?